Hello everyone, and welcome to Surviving to Thriving with Chronic Pain. I'm very excited to be presenting to you all. It's my first time being featured on the Stillpoint YouTube, and some of you might be wondering, who exactly am I? Well, my name is Brianna, and I am a clinical MSW intern at Stillpoint. I am in the second year of my master's in social work at UNCW. I take an individual caseload of clients at Stillpoint Counseling, and with my clients, I specialize in helping people use their strengths to manage their mental and emotional health to facilitate healing. The MSW program at UNCW is a strengths-based program, and that's certainly something that I take to heart. I also consider myself to be a holistic therapist, which means that I believe that the mental and physical health are interconnected, and we need both to be the best version of ourselves. So, today on Surviving to Thriving with Chronic Pain, we're going to go over some of the basics. So, what is chronic pain? What are some common chronic pain experiences? And how do we thrive as someone with chronic pain? First, what is chronic pain? Pain in general is the body's warning signal. We all experience occasional aches and pains, and the intention of pain is to let our bodies know that something could be going wrong, something's amiss. And for people with chronic pain, this warning signal doesn't turn off. For some of us, this pain can feel sharp, dull, steady, or intermittent, but what's important is that it lasts at least 3 months. It can occur in nearly any part of the body. So for someone with chronic migraines, their pain is going to exist in their head. Of course, not figuratively, but literally. And ultimately, chronic pain is a warning signal that just doesn't turn off. So why does chronic pain occur? And it can occur for different reasons. For some of us, this is an underlying illness, and it can mean that your body is sending those pain signals without anything actually going wrong. And for others, it is from a surgery or an injury, so perhaps there's something that had gone wrong and you got surgery to correct it, and your body is still sending those signals. And chronic pain can impact more than just physical health. It can also impact mental, spiritual, and emotional health as well. So chronic pain has the potential to apply to and impact every aspect of our health. So something to think about. What has been your experience with chronic pain? Is this something that you're here trying to figure out a little more about? Is this something that you've experienced in the past? Or maybe you've experienced it now and for a long time. Or perhaps you even have a loved one that experiences long-term pain and you're looking to learn more about what their experience could be like and how to help them thrive. So, what are some common chronic pain experiences? It's actually a bit of a trick question because chronic pain exists on a spectrum. And this means that chronic pain can feel different for different people. This means it can feel different in terms of intensity, it can feel different in terms of sensation. Some people experience sort of a pins and needles, while someone else could experience an electric shock. And there are so many other variations. And not only does chronic pain feel different between people, it can also feel different from one day to the next within the same individual. And this can mean consecutively, so literally from one day to the next, and it can also mean at different points in our pain journey. So with all of this going on, chronic pain can feel isolating, especially if we don't have people close to us that understand what's going on. Or maybe we're having difficulty explaining what's going on to our medical provider. But chronic pain can also create a community, because even with these differences that we still have the commonality of experiencing chronic pain. And it's not a one-size-fits-all, but it still can have such potential to fit us in terms of a community. So one thing that can impact our ability to experience chronic pain differently is that chronic pain is one aspect of our identity. So chronic pain, if people identify as someone with a disability, or if people identify as being disabled, or if someone with chronic pain doesn't even identify that way, their identity as someone with chronic pain is just one of the things of part of the beautiful spectrum of who we are as people. So when we take into account our gender, ethnicity, spirituality, chronic pain interplays with those other components of who we are. And the challenges and adversities that we may face as someone with chronic pain, is unique, because we're all unique. And if we learn about ourselves, learn about our personal experience, and advocate for our health, it's all a part of the journey. And keeping all of that in mind, chronic pain can be managed. So something to think about: how are you currently managing your pain? Maybe you're sort of lost and you're looking for some good suggestions. Or perhaps you go to a pain management specialist. Or maybe you take it on yourself and you like to do exercises or stretches, or have a certain diet that you follow. And all of these are different approaches to manage pain. So how do we go from managing, surviving, to thriving, right? Because unfortunately, the reality for many of us with chronic pain is that it can't be completely eliminated. So how do we go on? How do we get out of bed every day and not only just exist, but actually succeed and become happy, healthy, functioning members of society with chronic pain? Well, it's a good idea, and this is recommended by US Pain Foundation, to strive for a multidisciplinary approach. And what that means is that we are treating our chronic pain from different angles. Maybe, again, we're seeing a pain management specialist, or we are going to therapy, and we are taking into account different parts of what our chronic pain is affecting. So in that, if we educate ourselves on different strategies and treatments, we can figure out some things that might work for us that we didn't even know about before. And attending to each aspect of our health, because again, it's all connected, and that is on a physiological level, on an emotional level, and our wellness is the sum of its parts. So maybe you love yoga and it helps your pain about 20%. And then you also go to physical therapy and that helps you another 30%. So you are at about 50% of your pain treatment. And all of these things are going to add up and they are going to add to our wellness. And in addition to the things that we can do with professionals, we should embrace the value of self-management strategies and work smarter, not harder. So, what do we do when it comes to self-management? Well, we take ownership over our chronic pain, and that can mean different things for different people. So, for some of us, that could mean educating ourselves on everything that we can about chronic pain. Getting to know ourselves, and if it is because of an underlying illness, getting to know that underlying illness inside and out. For others, it might be getting into the advocacy side of things, going to your town hall meetings, and helping make your town more accessible for people with chronic pain. For other people, it could simply be screaming into the void that you are taking ownership over your chronic pain. So we also should reflect and rely on past experience. Make note of what's already working for you. Keep what's working and throw away the rest. It's all right. Keep what resonates with you, throw away the rest. The same with this presentation. I am really hopeful that something resonates with you, but if something doesn't, it's okay. Just pay attention to what's working. And overall, we should strive to incorporate pain management into our lifestyle. We're the expert in ourselves, and we're the experts in our healing. And if we build a lifestyle around pain management and chronic pain, we can do this. So, what are your pain management strengths? We all have them. Maybe you are super diligent and organized, and you have all of your medication lined up, and you have all of your appointments mapped out. Or perhaps you are all into physical activity, and you know exactly what exercises are going to help different parts of your body. We all have pain management strengths. And when we are thinking about how to create a lifestyle from chronic pain management, it's good to focus on that. So I know that can sound a little daunting, right? Pain management as a lifestyle, but it's actually pretty simple, and I hope that these tips make it even easier for you. So, as we already discussed, stay mindful of the ways you already take care of yourself. How are you practicing self-care? How are you practicing self-love? Give yourself a pat on the back for that. That's awesome. And show yourself some gratitude. Show yourself some appreciation, because it is awesome that you are taking care of yourself. Even coming to this presentation, it's amazing that you are taking additional steps to take care of yourself. So for the things that you are looking to change or add, start small. Even tiny changes can make a huge impact. And try to focus on what you can do, not what you can't. Because I don't know about you, but when I focus on the things that I can't do, I get kind of bummed. So if I focus on the things that I can do, not only does that help me keep a more positive outlook, but it also helps me feel more motivated to take action. It's also helpful to take it one day at a time, especially if we're in the mood to make some change and we're all motivated and ready to go. It can get a little tricky and to get ahead of ourselves, but we need to take things one day at a time. And healing isn't always linear. This can also be a tough one sometimes, right? Because if we are going up that hill and we are making progress and we're doing great, it can be super disappointing if there's a bump in the road. But it's okay, because healing isn't linear all the time. And if we listen to our body, it often tells us what we need. So if you have some hike planned out that you want to do and you wake up and ouch, not really feeling it today, that's okay. your body was telling you that that might not be the best idea today. And use trial and error to find what works best. Try and try again. So that means trying different things. That means maybe trying something that didn't work for you a different time, but you want to try it now? Sure, go ahead and do it. It's all about figuring out what works for us, because we are all unique and different things are going to work for different people. And the best part is that you don't have to do it alone. I, in fact, encourage you not to do it alone, because social support is amazing when it comes to our chronic pain journey. Our loved ones can be a part of the journey. And how do we start incorporating them? Well, if you have something that you already know that you're doing to take care of yourself, like making an awesome dinner that's gonna help with inflammation in your body, invite a friend. Or maybe you really want to incorporate some relaxation time and you're looking to start meditating. Again, invite your loved ones, see if they're willing to try it out with you. Believe in yourself, trust the process. You got this, I got this, we got this. Over time, this lifestyle thing gets easier, I promise. So something to think about. What is the next step in your chronic pain journey? Perhaps you are already thinking about what your strengths are and you're about to go get a notebook and write it down. Or maybe there's something that you learned about today that you want to go research some more. Whatever it is, I would love to know. What's the next step? I appreciate you listening today. It was awesome to present on something that I am passionate about, and I loved being here. So what chronic pain topic should we discuss next? If you would like some more of this content, I would love to know what type of content you would be interested in. So if you would like to go into more detail about something I talked about today, or if there's something I didn't even mention today that has to do with chronic pain, or you're interested in how it impacts people with chronic pain, I can definitely talk about that, especially if it is to do with mental health. And yeah, so I hope you all enjoy the rest of your day. Bye!